There are two main scientific aspects that I think are very interesting. One is basic and the other is translational. So it kind of answers both part of your questions, I guess. So one of the key unanswered questions for the cancer immunology field is really what does elimination of cancer cells look like when that occurs in very early stage lesions or when mutation encoded neoantigens or tumor antigens are recognized in smokers or in people that don't get that don't manifest disease. And I guess linked to that, the two main questions are, when does immune recognition first begin during carcinogenesis? That's quite a fundamental, key aspect of the biology that's not understood. And what are the principal defects in that immune response that break down, which facilitate and foster cancer development? Those are two key biological questions that I think are unanswered, that work in this field is beginning to address or attempt to address. Just, connected to that, I think it's a question of what really promotes recognition of these pre-invasive lesions. What are the types of antigens? And of course, we're focused on neoantigens. That's really been one of the fields we've been interested in for some time. But the question is open as to whether those are the key substrates for recognition in that phase of disease. We'd assume that's the case, back extrapolating from what we see in established disease. So then the question is, clinically, where does this research take us? And I think there's two really exciting avenues. One is early detection, the other is prevention. So, we don't have, for pre-invasive disease, we don't have really an economical, non-invasive test that we could use for population-level screening to stratify risk of patients that have these pre-invasive lesions to progress or not, or actually just to see if anyone has disease underlying that has otherwise not been detected. And so, if we take the aspects of what we've spoken about in terms of these early stage immune recognition and regulation, then what we could do is we could potentially use some of those signatures as a warning sign of ongoing cancer development. So, T cells recognize antigen, and the antigen is a surrogate of disease, and therefore changes to T cells could reflect underlying changes in carcinogenesis or disease development. So we could use immune-related signals potentially as a basis for a novel mechanism of early detection. That's one way of taking it. Secondly, I guess it's clinically what we'd want to do is, if we were to detect disease early, there are several ways of doing that. Immune system is not the only one. There are many different groups working on some fantastic models that have high AUCs and look like they have very impressive sensitivity and specificity for early detection. So hopefully we'll get there. The question then is, if you do detect pre-malignant disease, what do we do in terms of a therapy? And, again, there are many different strategies here. One is constant surveillance, to look at patients and follow them up routinely with bronchoscopy or CT scans to see how they're progressing. And if a patient was to progress to stage 1 lung cancer, then surgery with curative intent would be the option there. And we know that shifting detection towards early stages and intervening with surgery promotes survival in several key landmark studies that have been published in the literature in the last few years. So that's one option. But as an immunologist, really what we'd be interested in doing is trying to understand the regulatory landscape of T cells in this phase of disease. And so then opening the doors to a new field of checkpoint inhibition, which is targeted at these early pre-invasive lesions. And I think there's a lot more work then that needs to be done to establish what are the key checkpoints for signals holding T cells back specifically in this phase of disease. And therefore, could we potentially, target patients in a prophylactic setting with immunotherapy to flush out these tumors using the T cell response before they even form?